Yeah, that's fine.
All right. So first, I'm sure you heard that today Indiana has set a new record in daily COVID-19 cases, over 3,600 in one day. That's a big deal statewide, but how are things looking down in your neck of the woods?
Well, the increased numbers in the state are really frightening, and it's frightening because it is going to uh, result in the next 7 to 10 days increasing hospitalizations, and that will result also, unfortunately, in increased deaths. Uh, in Knox County, we are seeing a significantly increased number of cases. Just 3 weeks ago, we were actually in blue, which was very good, and now we're in orange. We've gone from approximately 5 cases per day up to 30 cases per day. Uh, we have had a couple of deaths this week. The deaths do take a while to show up on the state chart. We have reactivated our emergency preparedness COVID response team within the county, and we will be um, enforcing more restrictions as far as masking mandates. We will be attempting to restrict number of people in certain places. We will have discussions with the schools as far as reducing the number of people at indoor athletic events to perhaps family or just a limited number of people. Uh, we will be discussing altering the school calendar, not really just going virtual, but particularly after the holidays, as we follow this, as we follow how we are doing through the holidays. Uh, Other things that we talked about were in with churches, asking the churches to enforce masking and distancing in the churches. There is a holiday stroll in Vincennes, and we're considering limiting that. We are asking law enforcement to enforce masking mandates for businesses, and this would involve the store owners, if people are asked to wear masks and they do not, that they can call law enforcement to have people removed from the premises. The sanitation department, as we inspect restaurants and bars, will be enforcing masking mandates by employees in the restaurants and bars, so that if they don't, they will be cited for it. This does not usually involve a fine on the first offense, but if we come back and this has not been corrected, a fine will be levied. And the hospital is basically, we have room to take acute patients, but the hospital is in effect full. We have not had to transfer out patients because we truly don't have beds. But the hospital, I'm extremely concerned about if we continue at our present level, this is going to translate into increased hospitalizations and increased deaths in our community. And we really have to work as a community to attempt to get this under control at the present time.
Wow, so that's those are some really tight restrictions, especially the law enforcement portion. I know that that was kind of a controversial thing when the governor had initially said that there was going to be a mask
Yes.
mandate.
Yeah, this is important to understand, that this is not, people will not be cited for not wearing masks. They will not be ticketed, they will not be fined because they're not wearing a mask. What this is, if a store owner wishes to enforce the masking mandate and a person refuses to wear a mask, the store owner may call law enforcement. Law enforcement will assist in removing people from the property. And this is consistent with a trespass. It's not actually a masking mandate.
Okay, that's good to know because I know some people, they hear it and it gets confused.
Now, really, we are recognizing the psychological issues with this. We realize people are very tired of this. We are realize that portions of this have been politicized. We really don't want to create confrontation. But the fact of the matter is, this is really dangerous at the present time. And we do want the citizens of our community to know this, and that we are really obligated in doing our duties to make this known to the public and to do whatever we can to enforce good common sense public health measures.
When will these new restrictions take effect?
Basically, they already have. We will be announcing them. We'll try to make the public aware of them immediately.
Okay, well, we'll definitely make sure we have it.
With your help.
Okay, we'll say, yeah, we'll have it on our website and in our newscast.
Okay, thank you.
Yeah, no problem at all. Just one more. Oh, it's starting to
We
break.
will be, I'm sorry, we will be updating our emergency preparedness website as well as public health website. The hospital has been doing Facebook Live. We were going to make an effort to let the public know how serious this is for our hospital and our healthcare community.
All right, that sounds good. I think the connection is starting to get low again, but